Baby bottles. Kids love them, so parents love them too. But when they're not used properly, baby bottles can seriously harm your children's teeth. This condition is known as early childhood caries, and every year, thousands of children suffer from it. Early childhood caries can have serious long-term effects on your child's physical and mental health. The good news, parents can easily help prevent early childhood caries if they understand and follow proper dental hygiene. This short video will show you how. Your baby's primary teeth usually start coming in at about 3 to 8 months of age. Early childhood caries can start as soon as the first tooth appears. When a baby drinks from a bottle, the sugars found inside many liquids stick to the teeth. These sugars mix with plaque to produce acids that over time can dissolve teeth and create other problems. The 4 upper front teeth are the most affected by the sugars because the tongue somewhat protects the other teeth. But the problem can progress to all teeth. Let's talk to a dentist, Dr. Melody Zamora, who can tell us more about early childhood caries.
What kinds of problems do early childhood caries cause?
Well, even though children all eventually lose their baby teeth, they are extremely important. If they decay, your child can lose them prematurely.
What happens if baby teeth are lost too early?
Baby teeth serve as a guide for the permanent teeth. If they are lost too early, the permanent teeth can come in crowded or out of line. That can disfigure the face and cause long-term pain, as well as eating, speech, and social problems.
How do damaged teeth cause speech problems?
When children lose their teeth prematurely, they often have problems learning how to pronounce words correctly.
What about the social problems?
Unfortunately, children who have lost their teeth or have disfigured mouths are often teased by other children. This can severely damage their self-esteem. So parents should look for stains or white spots on the upper front teeth, because those stains could be the beginning of early childhood caries.
What should I do if I see stains?
Make an appointment and take your child to the dentist as soon as possible. If your child is an infant, the dentist may perform a knee-to-knee exam, which allows the parent to assist in this first dental appointment.
What are the most important things I can do to prevent early childhood caries?
First of all, it's very important to know which products cause the most damage. Ideally, you should avoid drinks that are high in sugars, such as soda pop, juices, and sugar water. Encourage your child to eat healthy snacks like cheese, raw foods, and certainly vegetables. Some of these snacks can actually fight tooth decay, and most products that are better for your teeth are also much better for your general health. For example, milk is good for you, but soda pop is not.
Do cow's milk, baby formula, and breast milk all contain sugars that can harm teeth?
Yes, they do, but they cause far less damage than highly sweetened products.
So what should I do?
Well, the damage only occurs when the sugars are left on the teeth for longer periods of time, so you need to remove these sugars regularly.
How?
There are several things you can do depending on the age of your child. For infants, carefully wipe your child's teeth and gums with a wet washcloth, gauze, or soft toothbrush after each feeding.
Should I wean my baby off bottles altogether?
It's a good idea to wean children from bottles when they reach the age of 12 to 14 months. And until then, your child should use a baby bottle only for drinking milk products. Sweetened products such as juices should be diluted and offered sparingly in a cup.
Are training cups a good idea?
Yes, parents should begin teaching their children to drink from a cup at about 6 months of age.
How come?
Baby cups minimize the amount of sugars that are left in your child's mouth. However, it's important also to limit the amount of juices offered and to not allow the child to carry a cup around throughout the day.
What if the baby cries between feedings or needs a bottle to fall asleep with?
Over the years, parents have shared with me a lot of good strategies. You can offer your baby a clean pacifier, a favorite blanket, or toy. You could hold or rock your child. Reading, singing, or playing music often helps. Or give your baby a back rub.
So what if nothing else works and I have to give my baby a bottle between feedings or to fall asleep with?
In that case, fill the bottle with water only and never sweeten it.
Should a bottle be used as a substitute for a pacifier?
No, it shouldn't. And remember, never dip a pacifier in sugar or honey.
Is it okay for a child to sleep at the breast all night?
No, it's not. because even breast milk contains some sugars.
Can kissing a baby cause tooth decay?
It's important for parents to be aware of their own dental health. If they have dental caries, kissing their baby's mouth can transmit bacteria and thus contribute to tooth decay in their child.
What can parents do to help prevent this?
Parents can ensure that the whole family follows good dental hygiene practices. These include visit the dentist, brush teeth regularly, floss teeth daily, and follow the dentist's fluoride recommendations.
When should parents bring a child to the dentist for the first time?
As soon as your child's first tooth appears, usually between 3 to 8 months old. If no teeth are showing yet when your child has a first birthday, a dental visit is also recommended. Of course, if your child is older and has never visited a dentist regularly, you should schedule an appointment as soon as possible.
What should parents tell their child about their first dental visit?
You should say that the dentist will check to make sure that we're taking good care of your teeth.
Should parents ever use a dental visit as a threat to stop them from eating improper foods like candy?
No, you never want to scare a child about a dental visit, and never let older children scare them either. If they are worried, try to assure them that they are safe and being well taken care of.
When should my children brush their teeth?
The best thing is to brush after each feeding. If that's not possible, brush at least once in the morning and once before bedtime.
How can I get my older children to brush their teeth on their own?
Children learn by watching their parents, so set a good example by showing them that you brush and floss daily. And if you eat healthy foods, they're more likely to also.
Can you show me the proper way to brush teeth?
First, make sure that you use a toothbrush with soft bristles. Use a small, pea-sized amount of toothpaste. Brush the inner surface, chewing surface, and the outer surface of teeth and gums using a soft, circular motion. Brush the tongue to remove bacteria and freshen the breath. There are many kinds of toothpaste available for children, but make sure that the brand that you choose contains fluoride and has been approved by the American Dental Association.
My children sometimes swallow toothpaste. Is that okay?
No. If it happens regularly, this can lead to a problem called fluorosis.
When should daily flossing start?
As soon as all the primary teeth have come in. Dental floss will get to those places that are hard to reach with a toothbrush. Hold the floss tightly and gently rub the side of each tooth with up and down motions. It takes practice, but it's certainly worth the effort. By the way, children below the age of 8 should not be expected to floss by themselves. Parents need to help them.
What about fluoride? Is it important?
Yes, fluoride is beneficial because it helps prevent tooth decay. In many cities, fluoride is already added to the drinking water. But even if it is, your child may need more. Ask your dentist to recommend what is right for you and your family.
No one wishes for their children to have early childhood caries, but the reality is that thousands of kids of all ages suffer from it. If your child has significant tooth decay, or if you even suspect early childhood caries, don't wait. Make a dental appointment as soon as possible. The earlier it is detected and dealt with, the better. As a parent, you can protect your child from developing early childhood caries by following the steps described in this video. If you have questions, we urge you to contact a dentist. Remember, early childhood caries can easily be prevented through proper dental hygiene. And by doing so, we can help our children enjoy a healthy smile for years to come.